On the last day of 21-day lockdown, Prime Minister Narendra Modi to address the nation at 10 a.m. today. Total number of COVID-19 cases so far is 9,352, while 324 people have died from the virus. 979 people have been discharged. Meghalaya reports the first case of COVID-19. Tamil Nadu and Arunachal Pradesh extend lockdown till April 30th. Madhya Pradesh Chief Minister Shivraj Singh Chauhan also in favour of extension of lockdown. Supreme Court modifies its earlier order on free tests for COVID-19 by private labs, allows them to test at ICMR rates, poorer people to be tested free under Pradhan Mantri Jan Arogya Yojana. Battle of humanity against COVID-19 continues across the world. More than 19 lakh cases reported till date. 1.19 lakh people have succumbed to the virus. US records 1,509 coronavirus daily deaths. France extends lockdown for another month. Italy's daily new coronavirus cases decline. IMF grants debt relief to 25 poor countries. Nation remembers Dr. Bhimrao Ambedkar on his 129th birth anniversary today. President, Vice President and Prime Minister greet fellow citizens on the occasion. Dr. Ambedkar was the chief architect of the Indian Constitution and was India's first Minister for Law and Justice. Good morning. You're watching DD News and I'm Preeti presenting the bulletin. Our top story first. Prime Minister Narendra Modi will address the nation today at 10 a.m. The 21-day nationwide lockdown to curb the spread of coronavirus ends tomorrow. The announcement was made yesterday by Prime Minister's office via a tweet. Last month, Prime Minister had addressed the nation twice on 19th and 24th of March. And Arun Sharma is joining us to talk more about that. Arun, when we talk of the Prime Minister's address, which will be given by him at 10 a.m., what could be expected? There is a lot of speculation of extension of lockdown, one point. Secondly, also many states, almost 10 states of the country have already extended the lockdown. What does it mean in the sense that how is the state lockdown different from the centre's lockdown, and how much are the states liable to stick to the centre's announcement of the lockdown, and can the states defy the centre's lockdown?
Okay, so Preeti, let me tell you that we know this fact that Prime Minister Narendra Modi will be addressing to the nation in 1.5 hours from now. So there can be three possibilities as of now. Number one, when the center, that means when Prime Minister announces a nationwide lockdown, that means if in case he goes ahead with the extension of the lockdown, that means lockdown 2.0, and he extends this lockdown with the same condition, in that case it will be, the lockdown will be there in the entire country, that 130 crore people will have to follow that lockdown. Second important part, as Prime Minister Narendra Modi said that in the meeting with the chief ministers and to the chief ministers, when he said that now our focus should be on Jaan and Jahan. That means earlier our mantra was Jaan hai to Jahan hai. That means focus was on saving lives and not livelihoods was not that much of priority. But now the focus should be on Jaan and Jahan. That means life and livelihoods. So Prime Minister Narendra Modi can give some relaxation. Now, important part is that these relaxations can be in a very prominent sectors which are related to the essential commodities like agriculture or the manufacturing units which are providing the support of the manufacturing items to the essential commodities. That means the relaxation can be given only in those pockets or sectors whereby the fact is that the commodities or the output is related to the essential commodities. So in that case, relaxation can be given, and that will be followed by the states, because if in case Prime Minister Narendra Modi says that we are giving relaxation to some pockets, that will be from the center side, and of course so in that case primarily relaxation will be given to that particular states as well. And third aspect is that Prime Minister Narendra Modi can come out with some out of the box ideas. That means he can, maybe he can give relaxation in certain hours of a day. That means from 8 a.m. to 10 a.m. This is just a speculation. Or he can give some relaxation in some pockets, in some areas. He can also announce, it is very much likely that he can divide the states into zone wise. That means the states like Maharashtra, Delhi, whereby the coronavirus cases are on a very much high as far as the numbers are concerned. So that can be divided into some extreme zones, and in the states whereby the cases are very much less or protected, that state is protected, that district is protected, there are no cases as of now. In that case, some kind of relaxation can be given. So at the end, Preeti, it all depends on Prime Minister Narendra Modi. He is known for coming out with out-of-the-box ideas, and this time also at 10 a.m. when he addresses the nation, it is not only 130 crore Indians. Globally, everybody would be watching that. What will be the strategy of a country like India, whereby the population is more than 130 crore? Preeti?
Yes, indeed. So we'll have to wait and watch for Prime Minister's address. Arun, stay with us. Let's apprise the viewers with the current status of the pandemic in the country. There are a total of 9,352 positive cases, out of which 8,048 are active. There are 979 people who have been discharged after full recovery. Added to this, the number of deaths are 324, and 25 districts across 15 states which had reported cases earlier have not detected new ones in the last 14 days. The Union Territory of Delhi saw a spike of 356 cases yesterday. Now, this is the sharpest spike in 24 hours in the national capital. Out of the 356,325 cases, rather, out of the 325 cases have link with the Marcus congregation. Now, going back to our correspondent Arun. Arun, we have given a broad outline of the pandemic in the nation as well as the national capital. So the important point here is that 25 districts across 15 states, they had reported cases earlier, but because of the lockdown, we see that no new fresh cases have been reported in the last 14 days. So that is indeed the silver lining in the dark cloud, we could say that.
I mean, let's look at the broad picture as well over here, Preeti. In our country like India, we have close to 740, 750 districts. So 750 districts on the whole as far as a country like India is concerned. Now, out of these 750 districts, less than 10% of the districts in our country can be considered as some kind of hotspots. That means the cases are more in the number. And there are many districts in our country which are not affected, or the districts which have recovered from this pandemic by doing a fantastic work of isolation and self-distancing. So look at this way, Preeti, that the World Health Organization has also praised the efforts of India in that context.
Yes.
And now on one side, whereby India has prepared a fantastic ecosystem, a healthcare ecosystem, you can say that, whereby we have a capacity of 1 lakh hospitals, 1 lakh primarily the bedding capacities going forward as far as the isolation beds are concerned. So in last 21 days, the healthcare infrastructure of our country has improved massively in order to treat the COVID-19 patient. So on the other side, India is also playing a global leader's role by providing the medical supplies, the drugs like hydroxychloroquine to close to 30 countries as of now, which also includes country like USA. So India is also playing a global role in providing medical supplies to other countries, and learning from the other countries, India is implementing the best practices in the, which are implemented in those countries into India. But our focus primarily will be completely on this strategy, Preeti, that this COVID-19 outbreak should not reach the tier 2 towns, the districts, the villages. So that's a complete idea. And in that context, only the Prime Minister Narendra Modi's strategy for lockdown 2.0, let me say by that, what it will be. We know this fact that lockdown is very much likely to be extended, but will there be some kind of relaxation, or what will be the strategy of Prime Minister Narendra Modi in order to combat the COVID-19 in villages, in tier 2 towns, in tier 3 towns? So that is something which needs to be focused upon as of now.
All right, Arun. So we'll end this conversation here. Thank you for joining in with your inputs. Let's wait and watch for what the Prime Minister will have to say at 10 a.m. That was our correspondent Anu Sharma joining us and getting us more details on the expectations of the nation from the Prime Minister when he addresses the nation today at 10 a.m. We'll keep you updated. Meanwhile, Meghalaya had its first coronavirus case yesterday when a doctor at Shillong's Bethany hospital was tested positive. In view of the development, State Chief Minister Conrad K. Sangma announced the imposition of strict curfew in Shillong for 48 hours. He also assured the citizens that the government is fully equipped to handle the situation and appealed to them to extend their full cooperation.
We have immediately imposed a complete curfew in the city of Shillong for the next 48 hours. Also, we request everybody to kindly cooperate and not to leave their homes for the next 48 hours. We have also sealed the institution that where the information has been found and the case has been found. And at the same time, in this institution, which is Bethany Hospital, all the people who have visited Bethany Hospital from the 22nd of March and after that, I would sincerely urge all the citizens to kindly inform us by calling at 108 number.
Meghalaya Chief Secretary M.S. Rao has clarified that the present case is the one with travel history and is not a case of community transmission as is rumoured.
It is a case of travel history, so in a way the reason is known. So, it's not a case of community transmission. So, to that extent, it is a positive.
Chief Minister K. Palanisamy yesterday announced the extension of lockdown in Tamil Nadu till April 30th. He said that the move was in accordance with the recommendations of medical and public health experts. Palanisamy had earlier favoured prolonging the curbs till the end of this month in a meeting with Prime Minister Narendra Modi on Saturday. Several other state chief ministers too batted for extension of the restrictions. The state cabinet gave the green signal for the lockdown to be extended till April 30th as per CRPC and the Disaster Management Act 2005. The extended lockdown will continue with the same restrictions of essential commodities outlets and restaurants being allowed to open from 6 a.m. till 1 p.m. in the afternoon. Additionally, bakeries have been allowed to open at the same timings and restaurants will allow takeaways. Ration card holders will get rice, dal, sugar, oil and other eligible items free of cost for the month of May. The families of unorganized workers, including construction laborers, will get cash support of Rs 1,000 each for the second time. Also, the guest laborers will get 15 kgs of rice, a kg of tur dal and a kg of edible oil free of cost. In Chennai, the state government has also made arrangements to help residents avail telemedicine services from doctors registered with the Telemedicine Society of India. Arunachal Pradesh also extended the lockdown till 30th of April with a few exceptions. The decision was taken in the state cabinet meeting chaired by Chief Minister Pema Khandu in Itanagar. The state has one confirmed COVID-19 case till now.
Will be continued in the state of Arunachal Pradesh till 30th of April 2020. So idea is that because this entire situation in the country as well as globally is becoming a very organic. So therefore we cannot take a very long duration decision at this stage. So the cabinet has taken a decision that this lockdown period in the state of Arunachal Pradesh will continue for another till 30th of April, and around that 30th of April we will take a further decision how we are going to control the activities in the state.
Madhya Pradesh Chief Minister Shivraj Singh Chauhan has supported the extension of the lockdown. Let's listen in.
सभी मुख्यमंत्रियों ने माननीय प्रधानमंत्री जी से परसों निवेदन किया था जब उन्होंने वीडियो कॉन्फ्रेंसिंग के जरिए मुख्यमंत्रियों से संवाद किया था। सब एकजुट है, एक मत है कि ये लड़ाई प्रधानमंत्री श्रीमान नरेंद्र मोदी जी के नेतृत्व में लड़ी जा रही है। बहुत प्रभावी ढंग से सारा देश उनके पीछे है। हम मिलकर इस लड़ाई को लड़ें और सभी का सुझाव ये था कि लॉकडाउन 14 को समाप्त ना किया जाए, बढ़ाया जाए। ये आग्रह माननीय प्रधानमंत्री जी से हम लोगों ने किया है। कल माननीय प्रधानमंत्री जी जब देश को संबोधित करेंगे तो लॉकडाउन की पूरी रणनीति जनता के सामने रखेंगे।
The Supreme Court yesterday modified a previous order with respect to providing free COVID test in private labs. In its modified order, the Apex Court said that the free testing for COVID-19 shall be available to persons eligible under Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana, as already implemented by the Government of India. Additionally, any other category of the persons notified by the central government as economically weaker sections of the society can also avail free testing. The court said that the government may consider as to whether any other categories of the weaker sections of the society, such as workers belonging to low-income groups in the informal sectors, beneficiaries of DBT, etc., are also eligible for the benefit of free testing. It has asked Union Government to issue appropriate guidelines in this regard within a week. The court allowed private labs to continue to charge the payment for testing of COVID-19 from persons who are able to make payment of testing fee as fixed by the ICMR. Amid the growing number of novel coronavirus cases in the country, the centre has issued an advisory for the well-being of 16 crore senior citizens who are above the age of 60 years across India and help them deal with COVID-19. As senior citizens face an increased risk of coronavirus, they have been advised to stay at home, avoid visitors, maintain 1 meter distance if necessary, and remain active at home, including light exercises and yoga. It also guides senior citizens about how to remain safe and take care for their mental health during the ongoing coronavirus pandemic. Dependent senior citizens and others must also follow necessary precautions. Advisory for caregivers of dependent senior citizens advise the dependent citizens to wash the hands before helping the older individuals, to diligently monitor health, and to ensure proper food and water intake, and many more such guidelines. Emphasizing on homegrown produce, Union Minister Piyush Goyal praised DRDO's initiative of producing N99 masks. He said that taking inspiration from Prime Minister Narendra Modi, DRDO has been able to produce such efficient masks, and these will prove to be beneficial in our fight against coronavirus. He also congratulated Defence Minister Rajnath Singh and DRDO scientists for their achievement.
श्री नरेंद्र मोदी जी के प्रेरणा से हमारे डीआरडीओ के इंजीनियर्स ने ये अति आधुनिक N99 मास्क बना के देश को समर्पित किया है। इस मास्क ने सभी टेस्ट पास कर दिए, यह अप्रूव हो गया है हर साइंटिफिक लैबोरेटरी टेस्ट से, और इसकी 12 महीने की अवधि है। ये 12 महीने तक आपके काम आ सकता है। मैं सभी डीआरडीओ के इंजीनियर्स को धन्यवाद भी दूंगा और आगे के लिए शुभकामनाएं।
An air evacuation pod, that is AEP, was indigenously designed and fabricated by Naval Aircraft Yard Kochi under Southern Naval Command for safe air evacuation of COVID-19 patients from remote areas such as ships and islands in a fully sealed patient transfer capsule, eliminating the risk of cross-infection to pilots and evacuation team with no requirement of sanitation of the aircraft post-evacuation. The evacuation pod, which was designed under the guidance of Principal Medical Officer of the Naval Air Force Station at Kochi, INS Garud, in consultation with specialists from the Naval Hospital, INNHS Sanjeevani, and the headquarters SNC, is made of aluminium, nitrile rubber and perspex. The highlight of the pod is that it weighs only 32 kgs and has incurred a manufacturing cost of 50,000, which is just 1% of the cost of an imported equivalent item. Trials of patients inside the pod were taken on aboard the Advanced Light Helicopter and Dornier aircraft of the Indian Navy at Southern Naval Command and successfully completed on 8th of this month. 12 such pods are planned for distribution across Southern, Western, Eastern and Andaman and Nicobar Naval Commands. The successful induction of the pods will vastly increase Indian Navy's abilities in its relentless efforts towards aiding COVID prevention across the nation. Governors of 6 eastern U.S. states have begun drawing up plans for reopening after the coronavirus shutdown. Officials in New Jersey, New York, Rhode Island, Connecticut, Delaware and Pennsylvania promised an overwhelmingly prudent approach but gave no timeline. Nationwide, the U.S. has recorded over 5,55,000 virus cases and 22,000 deaths so far. The largest number of fatalities is still in and around New York City, with the death toll passing 10,000. Now, according to the top U.S. health official, the outbreak could reach its peak in the United States this week as more signs of stabilization emerged. Meanwhile, President Donald Trump is expected to name a council this week to advise on reopening the country that will include his daughter Ivanka as a member. Spain let some businesses get back to work yesterday, but one of the strictest lockdowns in Europe remained in place despite a slowing in the country's coronavirus death rate. Although some activities, including construction and manufacturing, were allowed to restart, Health Minister Salvador Illa said that Spain remained in lockdown. Shops, bars and public spaces are set to stay closed until at least April 26th. Confirmed coronavirus cases totaled 1,69,496, while the total death toll rose to 17,489. In Italy, deaths from COVID-19 rose by 566 yesterday, up from 431 the day before. But for a bit of relief, the number of new cases slowed to 3,153 from the previous 4,092. The number of new cases was the lowest since April 7th. The total death toll since the outbreak came to light on February 21st rose to 20,465. The number of officially confirmed cases climbed to 1,59,516. This is the third highest global tally after United States and Spain. In France, lockdown has been extended until May 11 in order to curb coronavirus outbreak. President Macron said that progress has been made, but the battle has not yet won. Since March 17, people have been ordered to stay at home except to buy food and seek medical care. The lockdown was scheduled to end today. French President said that schools and shops would progressively reopen on May 11th, but restaurants, hotels, cafes and cinemas would have to remain shut for longer. He further said that international arrivals from non-European countries will remain prohibited until further notice. However, after a relentless increase until the first week of April, the number of patients in ICUs has started to decline. France has registered nearly 15,000 COVID deaths and has over 98,076 confirmed cases so far. And to aid the poor countries battling with the deadly coronavirus, the grant from International Monetary Fund comes as a relief. The International Monetary Fund on Monday announced that it approved an immediate debt relief for 25 poor countries to help them free up funds to fight the pandemic. The countries benefiting are nearly all in Africa, but also include Afghanistan, Yemen and Haiti. In her statement, the IMF Managing Director, Kristalina Georgieva, said that this provides grant to the poorest and most vulnerable members to cover their IMF debt obligations for an initial phase over the next 6 months and will help them channel more of their scarce financial resources towards vital emergency medical and other relief efforts. And in the latest updates on the COVID-19 situation in the country, there are a total of 10,363 positive cases, out of which 8,988 are active. There are 1,035 people who have been discharged after full recovery, and the number of deaths stands at 339. 25 districts across 15 states which had reported cases earlier have not detected new ones in the last 14 days. That's it in this edition of the News This Hour. Thanks for watching. Namaskar.